How's it going? My name is Jeff and I'm the OT Dude. I'm a licensed occupational therapist practicing in America. And while I was brushing my teeth today, I really thought of something that was probably a good metaphor maybe for you guys that I had an insight into about pain. So basically yesterday I went and got a booster shot for COVID. And some of you may know, some of you may experienced it, is that after you get a shot, you may have some soreness at the injection site. So I have here, I know this is not a shot, but it's the next closest thing that I can find in the house. And it's a, looks kind of like one if you're not a nurse anyways. It's a flush. A lot of people are okay with getting shots, even though it may cause them pain, because the understanding and the reason for getting it is a good thing. It's to prevent illnesses, disease, getting sick, and so on. So that's an interesting thought, because even though like right now I feel pain when I like move my arm and like right here, I'm okay with that because I know that it's hurting for a reason. So basically, I guess the point I'm trying to make today is that pain is not pain. So even though I feel pain right here, like at this moment, I'm okay with that. And there is less things like fear, uncertainty, like I'm not protecting it, like I'm going to move it because I know it's okay. It's probably going to go away because tissues heal and there's a reason for it. Let's assume that this injection was caused by something else. Let's say like a nefarious person had a needle in them and they just ran up to me and just stabbed me with it. Now, it's the same type of cause of injury, an injection. But now I would have, in this situation, if someone bad came up to me and like injected me with like some mysterious like fluid, then I would have a lot of worry and concern. So now having this same amount of cause of injury, this pain now is like amplified. I have all this fear and uncertainty, like, oh my gosh, like what if this person has like a condition or like some illness, or what did they even inject into me? Smallpox or whatever. So now whenever I feel this pain, I'm gonna like do something about it and like want to like maybe go to the doctor, try and like see what's going on. And it can cause a lot of things like anxiety, depression, more pain. So you see how the same type of like initial amount of pain, I know I'm not talking about like later on, like after like this develops and like swells up or something because it's like something bad that's going on, but same cause, different reasons for it, or like underlying reasons for like how it happened or why it happened, can cause a lot of different like just psychological response. So pain isn't pain in that there's more to pain than just the injury itself or like the tissue like damage. A lot of it really is psychological. So if you have pain and like chronic pain, especially chronic pain, that is defined as pain that lasts more than 3 months. And if you've been someone who's like seeking a lot of like medical professional help, doing a lot of like interventions, like seeking a lot of therapies, going to like the chiropractor, getting a lot of massages, and all the tests and imaging and your doctors and like multiple opinions tell you, hey, like I don't see anything that's going on there and like everything is healed and so on, then you maybe want to look at what are some other reasons that you may be having pain, or what are your kind of your story for pain or your perspective on pain is. So using my example of the injection, maybe you just got a quote unquote like shot kind of pain. So it has resolved, like long resolved, like in terms of the physical cause of pain. You may be having like this worry where it may be related to someone like who injected you, someone really bad with something, you know, like a mysterious fluid. And then you may be having this kind of pain, which is amplified and with good reason. What the point I'm trying to make is that even though you may be having pain that may be like a certain cause for it, really evaluate and look at how, or your story or your association of the pain and what's associated with it. I guess if that makes any sense, maybe you can overcome that. Even though we have pain, a lot of humans can do incredible things. We can go and run marathons. We can go to work. I think a study I read about was that more than like 50% of like physical therapists and occupational therapists or something have like physical lower back pain as they are treating like patients who themselves have lower back pain. So that's pretty incredible. The same probably goes for like physicians. I think a lot of you have heard about how dentists will have a lot of back pain, yet they are all still working. So just like how I have this pain right here, I'm going to go downstairs and go work on my backyard and build my gazebo despite this pain because I'm not worried about it. That's one thing to think about too, right? Because a lot of you guys may be thinking about, oh, what's the cause of the pain? Like what's going on? I might have hurt something. So if you have like really bad pain and like you have really bad symptoms, like you can't walk or you have like weakness, then that's probably something you should go and see a doctor and seek medical attention or input on and to see what's going on. But if it's like, an analogy is like an ankle sprain, like you sprain your ankle, ankles heal, they will swell up and you may have like numbness, right? How many of you guys have sat on the toilet for too long, like you're on your phone or something and you got off, like there's numbness and there's tingling, right? You're not worried about that. Likewise, if that persists and you're unable to walk because you have like weakness and you feel like your muscles aren't working, then that's something to be worried about. So if you're having a lot of pain, especially chronic pain, you know that, or you suspect that, or a lot of medical help and professionals say, hey, like you shouldn't worry about it, go and live your life, then maybe you want to look at how you're perceiving this pain. I'm not saying, and I'm not trying to minimize the pain that you are having because the pain that you have is very real. Like pain isn't made up and nobody knows that more than you. So what is really cool is that how you perceive the pain and how you look at it and think about it can actually help you to minimize the pain. And the more you do it and more you're okay with it, like just basically being okay and not getting like anxious or upset or angry even about that pain or what may have caused it or who may have caused it or who may not have been able to help it or who may have promised you something and like empty promises that you have spent a lot of money. Just try thinking about it a different way and you'll be very, very surprised about how your pain can actually disappear one day, because I've used it for my lower back pain and it is actually helping. And the very, very incredible thing that I'm finding is I'm now able to get off like drugs, like nerve pain, like super sensitive nerve pain kind of medications. I don't need to go to chiropractor anymore. I don't need to take like daily medications or over the counter like Tylenol or something. I don't need to seek other alternative treatments or whatever. Like I'm basically living my life with like no substances. I'm not drinking alcohol. I'm not eating the most healthiest. I'm willing to bet that if I ate even healthier than I currently am and not like donuts in the middle of the night, I probably would like go back to living my normal self. So that is really, I know this is one story and I'm just one person, but a lot of the research, a lot of the studies, and a lot of other people's experiences are showing this. One's brain can be very, very powerful because it is a source of how you perceive pain. If you find this content helpful, by the way, be sure to subscribe to my channel, OTDUDE. And I think I have a new handle now with the YouTube is it? Like OTDUDE for more occupational therapy content. And have a nice day. Thank you for watching.